The complications after foaling, the treatments and the risks. Vaginal and vestibular bleeding. So the bleeding after natural service, the hymen perforation causes minimal bleeding in the maiden mares. Vaginal rupture is due to a small mare, a large stallion, or small intestines from the vulvar lips. The diagnosis, speculum examination. So the treatment, if it's not infecting the peritoneal cavity, use a large lavage with saline, local antibiotics, a tetanus booster, and systemic antibiotic for 1 week. If it's entering the peritoneal cavity, use a tetanus booster, local and systemic antibiotic, and referral to surgery for maybe a peritoneal lavage. And for transport, suture the vulvar lips and use anti-shock therapy such as IV fluids. For an arterial rupture, it can be the uterine artery or the external iliac artery. It's most common in older mares, and the clinical signs are sudden death, anemia, shock, colic, and hematoma of the broad ligament. The diagnosis, you look at the signs in the ultrasound. For non-surgical therapy, do not move the mare, keep quiet, and do a blood transfusion. And oxytocin injection can be given only if the bleeding is in the myometrium. Do not give if there is a broad ligament hematoma. And when should a mare go for assisted reproduction? So in subfertile mares cause significant economic loss. You can give them ART, which is assisted reproductive techniques, such as AI, artificial insemination, ET, embryo transfer, OT, oocyte transfer, and ICSI, which is intracytoplasmic sperm injection. Uterine rupture. The causes are dystocia after normal foaling or uterine torsion. And 75% is the uterine horn, 25% is the uterine body. It can cause hemorrhagic shock, mild colic signs, fever, tachycardia, and depression. And you find out with rectal examination. And uterine flush can worsen the situation in a uterine rupture. And the treatment is, for small perforations, can be self-healing, and surgery done under general anesthetic from the midline, laparotomy. And the uterine prolapse, the causes are dystocia, abortion, too much oxytocin, placental retention, you pull it out gently. And the complications are uterine tears, hemorrhages, and prolapse of the bladder. The treatment are, watch out for shock, use standing or in general anesthetic. Uterus is examined for injuries and cleaning up. Your placement, make sure the uterine horn's extension and the vulva closure for 1 day. Use a uterine lavage after 24 hours and avoid oxytocin for 24 hours, up to 36 hours. And broad ligament hemorrhages occurs in the uterine artery, the ovary artery, and the external iliac artery. And it happens when these arteries are ruptured. And it happens before, during, or after foaling, often with dystocia. And in older mares, the clinical signs are bleeding to death, mild colic, pale mucous membranes, and tachycardia and weakness. The treatments are limited options, and you can give a blood transfusion.